Bismillahirrahmanirrahim. Today I am going to teach you about a very interesting tumor, Pheochromocytoma. There was an episode of House, its title was Acceptance, in which the victim committed a murder and he had sudden attacks of rage. He was brought to the hospital and House diagnosed him with a condition entitled Pheochromocytoma. And on the basis of this condition, he was declared innocent by the court. Now, what is Pheochromocytoma? It is a neoplasm which is composed of the chromophene cells present in the adrenal medulla, which synthesize and release catecholamines and in some cases some other peptide hormones, and it gives rise to surgically correctable form of hypertension. Rule of 10 is important because it can be asked in OSPE or in Viva or can be asked in a written exam. 10% of the adrenal pheochromocytomas are biologically malignant. 10% arise in association with the familial syndromes MEN 2A, MEN 2B, type 1 neurofibromatosis, VHL or Sturge-Weber syndrome. 10% are extra-adrenal. Please, it is important to remember that the extra-adrenal pheochromocytomas are called paragangliomas. They have all the symptoms, all the features and all the diagnostic criteria of pheochromocytomas. They are just extra-adrenal. And what are the sites? Organ of Zucker candle and carotid body. 10% of the adrenal pheochromocytomas are bilateral. And malignancy is more common in the extra-adrenal paragangliomas. Morphology, they range from small circumscribed lesions to large hemorrhagic masses. And there is an important differentiating point that if the fresh tissue is treated with potassium dichromate solution, the tumor turns dark brown. It is due to the presence of granules containing catecholamines. This is the gross picture of normal adrenal gland. The outer part is known as the cortex and the inner portion is medulla. Here you can appreciate the medulla has been enlarged by the tumor, which is yellow tan, and it is well defined, confined, and it has compressed the adjacent adrenal gland. Microscopically, please remember the pattern is known as the Zell-Ballon pattern, in which the tumor cells, which are polygonal to spindle-shaped chromophene cells, and the supporting cells are compartmentalized into smaller nests. There are nests of chromophene cells, and these chromophene cells are polygonal to spindle-shaped, and these nests are separated by rich vascular network. This pattern is called Zell-Ballon pattern. The cytoplasm has granular appearance due to the presence of catecholamine containing granules, and it can be highlighted by a variety of silver stains. Now this is the Zell-Ballon pattern, nests of tumor cells separated by rich vascular network. The bizarre cells can be found in the tumors which are biologically malignant. On electron microscopy, you can see variable number of membrane-bound electron-dense granules representing catecholamines and sometimes other peptides. The nuclei can often be pleomorphic. But please remember, in endocrinology, the criteria of malignancy is entirely based on metastasis. Both capsular and vascular invasion may be encountered in benign lesions, and the presence of mitotic figures per se does not imply malignancy. Therefore, the definite diagnosis of malignancy in pheochromocytoma is based exclusively on the presence of metastasis. And this point you can be asked in multiple choice question. Metastasis can involve the regional lymph nodes as well as the distant sites, lung, liver and bone. The clinical feature is hypertension. The patient presents with episodic attacks of hypertension, abrupt precipitous elevation in blood pressure associated with tachycardia, palpitations, headache, sweating, tremor and sense of apprehension. In practice, isolated paroxysmal episodes of hypertension can occur in patients with pheochromocytoma. In majority of the patients, there is chronic sustained elevation in blood pressure, although element of labile hypertension can also be present. And this hypertension is associated with increased risk of myocardial ischemia, heart failure, renal injury, and cerebrovascular accidents. Sudden cardiac death can occur due to myocardial irritability and ventricular arrhythmias. The predominant hormone which is produced is catecholamine. However, some other hormones can be produced like ACTH and somatostatin, and the clinical features are produced accordingly. The laboratory diagnosis is increased urinary excretion of free catecholamines and their metabolites, vinyl mandelic acid. This is important to remember because you can be given a clue about pheochromocytoma in MCQ. Vinyl mandelic acid and metanephrines. These are the byproducts which are seen in urine of the patient of pheochromocytoma. Isolated benign pheochromocytomas are treated with surgical excision and after pre and intraoperative medication of patient with adrenergic blocking agents so that the blood pressure can be controlled. Multifocal lesions may require long-term medical treatment for hypertension. Thank you, class.